All right, let's jump right in and break down the OET speaking assessment criteria. The first thing you've got to grasp about the OET speaking test is that it's completely different from other English exams. It's not a test of your personal opinions on random topics, not at all. Instead, it's a full-on simulation of your professional communication skills in a real healthcare setting. And understanding that difference, well, that's the key to everything.
So, how do they actually assess this professional communication? It's all broken down into two main pillars. Getting your head around this structure is the very first step to practicing the right way.
Think of it like two sides of the same coin. On one side, you've got the linguistic criteria. That's the nuts and bolts of your English. And on the other, you have the clinical communication criteria, which is all about how you use that language when you're with a patient. The test gives a lot of weight to both, so you really can't ignore either one. Okay, let's start by digging into the first of these, the linguistic criteria. This is all about the mechanics of your English. Now, get this, because it's super important. The focus here is purely on how you use English, not on your medical knowledge. The examiner isn't grading your clinical diagnosis, they're grading your language delivery. Honestly, that should take a little bit of the pressure off. This slide lays out the first two linguistic criteria perfectly. So on the left, you've got intelligibility. Basically, can the listener understand you clearly? Notice it's all about stress, rhythm, and intonation. And on the right, you have fluency, which is about that smooth, natural flow of speech, trying to avoid those long, awkward pauses or too many ums and ahs. Moving on, we have appropriateness of language. This sounds a bit formal, but it just means using the right tone and words for a clinical setting. And next to that, you've got your resources of grammar and expression, which looks at the range and, of course, the accuracy of your grammar and vocabulary. So, to wrap up this first part, just think of the linguistic criteria as the engine of your communication. It's all about the mechanics, the quality of your English. It's the foundation that everything else is built on. Now, let's move on to the second core area. And this, right here, is what makes the OET so unique. The clinical communication criteria. This is where your professional skills really get to shine. Here, the focus does a complete 180. It's no longer just about your language skills. It's about your ability to communicate with real care and empathy. It's less about what you say and so much more about the impact it has on the patient. This section kicks off with relationship building, showing respect, establishing a good rapport with the patient. Then it's about understanding the patient's perspective, which means you're actively listening and showing them that you really hear their concerns and feelings. Next up, you're assessed on your ability to organize the conversation in a logical way. That's called providing structure. And then there's information gathering, which is all about using effective questions to get the clinical details you need. And notice here on the slide, a key skill is knowing how to move from those big, open questions to more specific, closed ones. And the final piece of the puzzle is information giving. This assesses how clearly you explain things and, just as importantly, whether you check that the patient has understood you. It's a two-way street, right? Not a one-way lecture. So the key takeaway for this section is huge. You can actually score very well here by demonstrating empathy and professional care, even if your English isn't perfect. Your attitude and your interaction strategy are just as important as your fluency. It's a real game changer. Okay, so now that we've broken down what the examiners are looking for, let's talk about how you can actually use this knowledge to shape your preparation. Here's a really powerful strategy that applies to both the linguistic and the communication criteria. Focus on learning and practicing whole phrases, not just single words. Why? Because we naturally speak in chunks of language, and practicing this way will help you develop a much more natural rhythm and flow. This slide lays out a really clear three-step path. First, you just repeat common phrases over and over until they feel like second nature. Then you practice until your delivery is automatic, so you don't even have to think about it. And only once you've built that solid foundation should you start focusing on expanding your range of expressions. For improving your linguistic skills specifically, reading aloud is an absolute game changer. It helps you internalize the natural rhythm and stress patterns of English, which will make you a way more confident speaker, because the words will just feel more natural in your mouth. And that brings us to the final and maybe the most important question you should be asking yourself as you prepare. In every single practice session, just take a moment to reflect. Are you just practicing what you say, or are you actively practicing how you communicate? Are you paying attention to the structure, the empathy, the clarity of your interactions? Because mastering the how, well, that's the real key to success in the OET.